Hi everybody, today I'm going to discuss about occupational health sciences in public health. Hi, I'm Associate Professor Victor Ho from the Center for Occupational and Environmental Health UM. This session is going to be divided into three. The first is Basis for Occupational Health, Work on Health and Health on Work, followed by Principle of Identification and Control of Occupational Hazard, and finally, Brief on Occupational Related Diseases. So this session, we're discussing about basis of occupational health, work on health and health on work. What is occupational health? Occupational health looks at the health of the person and the effect of it from work. So, how does the health of the person affect the person's work, and how does work affect the person's health? So, we continue by looking at what is health. Health basically consists of genetics and determined by what you do, what you eat, your socioeconomic status or how is your financial status, your psychosocial or what you think, and finally the environment. The environment can be home environment, general environment, or in this case we are discussing about the occupational environment. So a worker can be healthy or they can have latent disease. Latent diseases are diseases that are present but there's no clinical symptom or sign, and you can have clinical disease where the sign and symptoms are also seen. So what are we concerned about? We are concerned about the workplace and the type of work or your job, and how would the workplace or the type of work or your job interact with the health or affect the health of a worker. What is the effect of work on health? What is the effect of a dusty work environment on the health of a worker? Let's look at paddy milling and paddy dust. All right? Can it cause asthma? Can it affect the heart? Can a person with asthma work in a dusty environment? Will the dust make the asthma worse? Can a person with heart disease work in a dusty environment? And will the dust make the heart disease worse? What else besides dust in the work environment can make the asthma worse? And what else besides dust can make the heart condition worse? So in occupational health, we are concerned whether and how the job will affect the health of the worker or pre-existing health condition. So work. You can be a pilot, a construction worker, a pizza delivery man, or an office worker. And you can be healthy, or have latent disease, or have clinical disease. And it can proceed to latent disease, clinical disease, and death when you are working. We want to ensure that you stay healthy and don't have latent or clinical disease as the basis for occupational health. Just now we look at work on health. Now we continue our session with looking at health on work. What do you mean by health on work? Basically, what is the effect of health on work is, what is your current health condition when you go to work? Does it affect the work or not? How does a pre-existing health condition affect the ability of a worker to perform his or her job? Like a pilot, or office worker, a pizza delivery man, or a bus driver. How does the heart disease affect the worker's ability to work? Let's say you are a bus driver and you have a heart attack. What will happen when you are driving the bus full of people? So you'll be involved in an accident. That may be okay because it is still on the ground. What if you are a pilot and you have a heart attack, and then what will happen? But the same condition, heart condition, for office worker or a pizza delivery boy is different. It does not affect the other people or the job. So if you have heart disease, or while you're working as an office worker or a pizza delivery man, then it's okay. Or it's more acceptable when compared to working as a pilot or a bus driver. So we understand from occupational health perspective, pre-existing health condition is considered differently for different type of job. To sum up the basis of occupational health is work on health, and we look at work should not be harmful to the health of the workers, and looking at health on work, where a worker should be fit to do his job and should not impede on the safety of the job, workers, client, and public. Thank you for your attention.